Let's talk about atrial arrhythmia. So atrial arrhythmia means arrhythmia arising from the right atrium or left atrium. Normally atria is depolarized by sinoatrial node. So this current depolarizes right atrium and left atrium, and then this current goes to the AV node, and AV node then depolarizes ventricle. So this is normal conduction system, but let's suppose there is one focus here that is generating electrical activity, high electrical activity. Actually every cell of the heart, or you can say every cell of the body, generate electrical activity, but the voltage is very low in those cells. In these cells there is very low voltage. That's why they are not able to take the pace as this pacemaker, because this can generate high voltage. Similarly, compared to these cells, if there is one focus somewhere in the atria that is generating more voltage, right? So this high voltage, if it has a high voltage, it can reach to the AV node and it can depolarize the ventricle. That's why it is significant. If there is, let's suppose there is one focus and this focus is generating only low voltage, and this voltage dies while reaching here, and it cannot reach to the AV node, so it cannot depolarize the ventricle. But if there is some focus in the atria that is able to generate enough voltage so that it can reach to the AV node and depolarize the ventricle, then that becomes significant. Because if there is abnormal atrial activity causing abnormal ventricular depolarization, then ventricular rate will also increase in proportions to atrial rate, right? So this impulse is generating electrical activity, this is reaching here and this is depolarizing, this is also generating, this is also reaching here, this is also depolarizing, this focus is also generating voltage, this is also reaching, this is also depolarizing, right? So there is too much impulse is coming to the ventricle, and if ventricle receives too much impulse, then it can go into ventricular tachycardia, right? And when there is tachycardia in the ventricles, the diastolic time period will decrease, and you can guess cardiac output will decrease. So that's why it is important. But there is a gatekeeper here. This AV node is called a gatekeeper. It does not allow all impulses to pass through this gate to the ventricles, because this is the design of nature. Because let's suppose there are two focus here, this is also generating impulse and this is reaching AV node, this will also depolarize the ventricle. So when the AV node senses too much impulse is coming from the atria, then it does not allow all impulse to go to the ventricle. And which impulse will go, which impulse will not go, this is not fixed. Any impulse can go, any impulse cannot go, depending upon the refractory period in this AV node. So atrial tachycardia, what is the rate in atrial tachycardia? 100 to 250 per minute. So if this whole atria is depolarizing at this rate, we call it atrial tachycardia. So this can be single focus atrial tachycardia, or it can be multifocal atrial tachycardia. So let's suppose there is only one focus, then we call single focus focal atrial tachycardia. But there are 3-4 focus, then we call it multifocal atrial tachycardia. But the rate of the atria will remain between 100 to 250. Let's suppose the rate is between 250 to 350 per minute, then we call this atrial flutter. We won't call it atrial tachycardia. It is not the only difference in rate that differentiates atrial tachycardia from atrial flutter. Otherwise, why do we need to keep the cutoff to 250? We can also call 350 as atrial tachycardia. But why they have kept the mark here between 250? So if it goes 250 to 350, then why do we call atrial flutter? Because this has different mechanism of atrial depolarization. So here there is abnormal focus, right? But in atrial flutter there is abnormal re-entry circuit is formed. So let me again draw the heart for you. And this is the right atrium, this is the left atrium, this is left ventricle, this is right ventricle. So in atrial flutter there is abnormal re-entry circuit is formed, right? So this is normal SA node. This depolarizes the AV node and this impulse goes to the ventricle. But from these re-entry circuit also impulse reach here, right? And this also depolarizes the ventricle. So this is not the only the difference in rate, but it is the difference in mechanism. Here there is re-entry loop here that is causing atrial flutter, right? And if the rate goes beyond 350, then we call atrial fibrillation. Atrial fibrillation. So the rate of atrial fibrillation is typically between 350 to 600 per minute. So the mechanism in atrial fibrillation is different from atrial flutter. So here in atrial flutter there are fixed re-entry loops. That's why you can see there is fixed narrow complex tachycardia in atrial flutter. Atrial flutter you will see there is regular narrow complex tachycardia, unlike atrial fibrillation where it is irregular. So since there are fixed re-entry loops, there is fixed atrial rate and fixed ventricular rate that is occurring regularly. But in atrial fibrillation, what occurs that if you imagine this is heart and this is the right atrium, this is the left atrium, left ventricle, right ventricle, there are multiple focus of electrical depolarization in the atria, and there is not such fixed re-entry loops. This is disorganized. Some is going in this direction, some going in this direction, some vector in this direction. So this is chaotic. You can use the term chaotic. That's why the rate goes as high like 500, 600 per minute. And you know, as I already told you that to depolarize the atrium there should be crossing of at least a threshold voltage. But here there are more current generation, but these current are not able to reach the threshold voltage. So if these cannot cross the threshold voltage, it cannot depolarize the atrium. So atrium cannot be depolarized, and thus if it is not depolarized, atria can't contract, right? Atria can't contract. So it is just like quivering motion, like you might have observed your body, your muscles, some muscles are just flickering like that, but it is not able to generate proper movement like this. So this is useful motion, but when there is just flickering motion of your muscle, it is irritating, it does not serve any purpose. Similarly, there is too much current in the atrium, but these are not serving any purpose because this is not able to reach the threshold voltage, so it cannot depolarize the atrium. This is just waste of energy, or you can say waste of current, right?